So we're redoing this patient's liposuction of her belly. She had a tummy tuck and some lipo, and she was left with this huge bulge up the front of her belly. She has these overhangs on the side. It's a little trickier when you're redoing it because of all the scar tissue. So what we're going to do to start is we're going to break up all this scar tissue and break up the fat. And we're using this basket cannula here to do it. And it's basically just knocking the fat up and breaking it away from the scar tissue. And it makes revising something like this, where she has so many irregular contours, easier. So we're just going to keep going to start till we get all the scar tissue broken up. And then once we get that done, we're going to go back and we'll actually do the real liposuction. But this is important to help make it smooth. And you can kind of see as I'm passing through that it's got some resistance. And that's from the previous liposuction, also from the scar tissue from the abdominal plasty. And this will just help when we get all released to remove that tissue without getting any scar irregularities from it. But it's a little tedious because we're just going round and round, hitting all the areas, and you want to keep doing it until there's almost no resistance. I can feel it like right up here against the skin even. I'm trying to break it up right along the skin surface here. And this part in particular I want to focus on because she was left with a big bulge, which really made her look abnormal. She even mentioned that given the results she had, she looked worse than when she started and when she hadn't done anything, which is unfortunate. That really shouldn't be the case. A tummy tuck in general is a very good operation that gives people a really nice flat abdomen. So once we get her corrected here, though, I think she'll be really happy with it, because we'll be able to get her belly flat again. We'll get her contours better. And then maybe later on we'll come back and lower her scar to kind of get rid of that, either by just cutting it down and pulling it, or redoing the whole tummy tuck would be ideal, but I don't know if she'll want to go that extreme. I tell everybody it's always better to get it done right the first time. It's much easier. Feel it in here where she's got that scar tissue around that bulge. I'm quite aggressive when it comes to like seromas, and seroma just means like a collection of water or fluid from the body that's not blood. So if patients have this, I really try and get rid of it. I know some surgeons who don't do anything, they just watch it, but this is done what they call organize. So it's turned into scar tissue, and then it's much harder to get rid of. If you get it drained properly the first time, and you stay on top of it, then you don't run into this kind of problem. But seromas are relatively common from liposuction, because if you think about it, you're taking all that tissue away and just leave a big open space. And to get, the body to get rid of that open space, it abhors a vacuum, like they always say in science. Fills it up with fluid first, and then the fluid can turn into scar tissue. This one is a lot different than the surrounding tissues. I'm going to work this left side here next. Break that up. Scar tissue when I get close to that central spot right in here.